Welcome back. Good to have you along. As always, you're watching Ozarks Tonight. I'm David Oliver. You know, you hear the year 2020. What else might come to mind? Well, perfect vision, 2020 vision, right? Well, the American Academy of Ophthalmologists, a nationwide group, has come out with some 2020 eye health observances. It's a topic each month designed to give us, as consumers, some more information about our eye health. And we want to get you more information throughout the year of 2020 about these various eye health topics. We've invited in a special guest to give us more information. This is Dr. Sachar Tauber. He is an ophthalmologist and cornea transplant surgeon with Mercy Hospital, also the lead physician for Mercy Specialty Eye Care. Dr. Tauber, good to see you.
It's great to see you.
Before we get into January's eye health topic, tell our viewers a little bit about you and your background. I know you've been with Mercy for quite a while.
This marks the 15th year that Debbie and I arrived in the Ozarks from Connecticut. I was a professor at Yale before that and recruited here to help build the department, and we're just extremely thrilled by how much it's progressed over the years. This year we celebrate 7 years of being an all laser cataract program, the only one in the country that allows patients access to the laser without extra cost. Something we're very proud of. Our research is exciting in some of the topics that we'll talk about later through the course of the year. We'll touch on those things. We love this community.
Sure.
It's just embraced us, it's welcomed us, and every time my mom calls up from New York and says, come home, I said, no, move here.
You're happy in Springfield. Well, let's get to the January eye health topic. Again, the American Academy of Ophthalmologists coming out with this 12 different eye health topics for the year. January is all about glaucoma awareness. I know we've all heard that term before. A lot of us probably don't know what it means. Tell me more about what glaucoma is.
It's a very frightening term to someone who hears it because they associate it with blindness.
Okay.
And left untreated, it could lead to blindness. And because a majority of the glaucoma we see doesn't have a symptom that can say, oh, my eye aches or it tears, it actually sneaks up on us like high blood pressure does. And so it's a silent thief of vision, potentially. So we have to screen for it. And there's certain things we know that are risk factors. One of it is just the amount of time we go around the sun, how old we get. And then it's family history, it's race, it's medications and other things. But you do need to screen for it to get the treatment appropriate, because done appropriately and treatment done in the proper timing can prevent vision loss.
So how do you diagnose this? Because I understand that glaucoma can kind of be tricky because in the early stages you often don't have a lot of symptoms.
You have no symptoms in the beginning, and it's one of those things that we see in a routine screening. So you'll see around the country routine screenings that patients will come in, they'll give an eye history. So if you have a family history of glaucoma, then that's one red flag. If there's been previous surgeries or diabetes, age is another. And then we check the vision, we check the pressure of the eye. That's the one thing we can measure directly, because we know there's a correlation with a high pressure and the risk for developing glaucoma. So not all cases have a high pressure, but the ones that you can catch early are the ones that you can see by pressure. We then look at the eye, and there's certain things in the eye, in particular the nerve of the eye, which is the forward part of the brain. We could actually see the brain by looking in the eye, and that's where the glaucoma will affect. So if we see things that are asymmetric, because we like to have symmetry between our two eyes, and if one eye looks that it has a change in the shape of that nerve, that is a risk that we also want to look at, and we can go and follow this up with more serial examinations. And then at some point we decided there is a high enough risk for the development of glaucoma, and we initiate therapy.
Okay, and what does that therapy consist of? What's the treatment option here?
The treatment options usually are eye drops that we use from 1 to 3 times a day. There are multiple different ones that we can use. The easy one you put on right before you go to bed, has very little side effects and is very effective in lowering the pressure. There are other drops used twice a day, and we have to watch for patients with heart disease or asthma or anything like that. And then we follow with more specific tests to look at the visual field, the periphery. Because if glaucoma affects us, it affects us in the periphery before it comes forward. So it's harder for me to say I'm losing my peripheral vision unless I test it. So serial examinations, including dilation, which most people don't like, but it's very important. And we follow, and we keep a target pressure. So the doctor will look at the risk factors, and she will figure out this is what the pressure should be for you as a patient. If we stay within target, then those medications work. If not, we add more medicines. And then if we are beyond the medicines, or if there's an issue with tolerating the medicines, or since this disease affects older people, compliance. The ability to put the drops in the eye may be reduced. It may be because of physical ailments like rheumatoid arthritis. It could be from issues of not comprehending the importance of it. It could be that they live alone and don't know how to do it themselves. So we move on to treatments that include lasers that can be done in the office that are very easy to do and require minimal post-operative care, all the way up to surgery in the operating room that can really liberate these patients from the use of drops.
Okay, we got about a minute and a half to go here, and I was going to say we're going to tell you how to get more information on glaucoma shortly, but just in your time as an ophthalmologist, and you're an eye surgeon, obviously, you know, so many times we used to hear about, oh, I've got some eye condition, and it was the end of the world, and that's not the case anymore with all the new advanced technologies.
It's revolutionized since when I finished training and when I interviewed here at Mercy to now we're interviewing our new docs, and what they're bringing to us is so exciting. You could take care of a cataract and glaucoma in the same surgery. The patient doesn't even know that the glaucoma surgery is being done. It's that quick, and it allows patients to decrease their drops. The improvement is something that's incredible. It's pushed by the Academy of Ophthalmology because we want to prevent vision loss.
Sure, sure. Well, it's fascinating, and if you'd like to get more information on January's eye health topic of glaucoma, you can visit the American Academy of Ophthalmologists at aao.org, or you can learn more about Dr. Tauber at mercy.net. You're going to come back next month with us, and you're going to talk about, I'm going to say this slowly, age-related macular degeneration.
Yes.
That's a mouthful.
Yes, it is a mouthful, and we like to call it ARMD for short.
ARMD. That's
Yes.
what I'll call it during the interview next month. Dr. Tauber, thanks a lot. And again, that'll be coming up in February as we let you know more about Eye Health Awareness Year here in 2020. More Ozarks tonight after this quick break.